Hello everyone, how are we doing? Today we're going to be continuing our series on regional anatomy, but this time we're going to be focusing on the wrist and the hand. So let's get started. In the previous two lectures we covered the forearm. Now I didn't cover the distal bones of the forearm, but we'll cover them in more detail right now. So we can see that in this radiocarpal joint, we've only got the radius that is attaching to the carpals of the hand. The ulna actually doesn't touch or form a joint with the carpals of the hand. As such, only the distal radius and the articulating facets articulate with the wrist here. Despite the ulna not actually making any contact with the carpals directly, it still plays a big role in muscle attachment and wrist stability. If we look closely, we can also see the distal radial ulnar joint, where the ulna, the head of the ulna, articulates with the ulnar notch of the radius right here. Now, another important anatomical feature of the radius and the ulna are the styloid processes here. What these help are muscle attachment as well as ligament attachment and help increase joint congruency. If we go posteriorly on the radius, we can see this groove that forms. This is known as the dorsal groove, and it's also another important site for muscle attachment, which we will get into next video. Now moving on the hand, so we can see that we have the carpal group, which is these little bones all bundled together. We've got the metacarpals, which are the longest group. And then we also have the phalanges, which is made up of three distinct groups. Other than the thumb, otherwise known as the pollicis, which only has two phalanges. Now in terms of naming them, we'll start off on the posterior side when we're naming these. The first main one, which is most proximal to the radius, is this one here, and this is known as the scaphoid bone. The scaphoid bone plays a big role in articulation with the radius and has the largest side of contact. It also has this tuberosity here, known as the scaphoid tuberosity, which is also important for flexor retinaculum and muscle attachment. The next important bone that helps with the radiocarpal joint is this bone here, which is known as the lunate bone. The lunate bone also forms an important role in articulation of the radius. Furthering on from the lunate bone, we've got this large bone. Now it looks like two large bones, but as we go to the side view, we can see there's this kind of split between them. The reason why is because this bone at the top is actually a sesamoid bone. This bone here is known as the pisiform, and it's actually wrapped in tendons and ligaments, and you can actually move it. If you relax your wrist like this, feel this pointy edge on the medial aspect of your wrist. If you feel it and then you relax your wrist, you can actually move it around because it's only a sesamoid bone. Since it's not embedded in a ligament, it's only embedded in muscles, so it's actually pretty easy to move around, which is pretty cool. Now the next bone, which is actually below it, this bone right here, this is known as the triquetrum. The reason why is because it's kind of got three facets. So it's got the facet at the top, it's got this facet that articulates with the hamate, and then it's got this facet that articulates with the lunate. So it's called trike, so it's three faces, quetrum. The other bone, which is at the front, which I just mentioned, is the hamate bone. And we can see it's pretty long looking bone. It's got this hook at the top, that's called the hook of hamate, which is also another important site for muscle attachment. Now the carpal in the middle is known as the capitate bone. The capitate bone is just in the central, and it helps increase the joint congruency of the wrist. The bone right next to that is the trapezoid bone, and right next to that is the trapezium bone. So the trapezoid bone is most medially, and the trapezium bone is the most lateral bone. We can see that, like the scaphoid, the trapezium bone also has this tuberosity at the top to help with muscle attachment and attachment of the flexor retinaculum, which we will cover in the next video. So, in terms of joints in the carpal bones, so the first joint, the radiocarpal joint, is actually a synovial condylar joint, which means it's kind of like a ball and socket joint, except it's a bit less shallow and a bit more ellipse in its shape. Now, in terms of all the other carpal joints, most of them are actually plain joints. But if you go to the intercarpal joints, so this line here, some of them are actually synovial condylar joints, but most of them are synovial plain joints. The joints between the carpal and the metacarpals, they're all synovial plain joints too. Aside from this special joint right here on digit 1, or otherwise known as the pollicis, which is a synovial saddle joint. Now, where you can imagine this is we can imagine this bone here as the saddle, and the saddle tapers off to this side and also tapers off to this side. And we can imagine the metacarpal, at least the proximal part of it, this flared off area here and this flared off area over here, we can imagine them as the legs, as someone sitting on it. And as they sit on it, they can move side to side, they can move forward, they can move back. And that's what allows the thumb to move so easily and move in all directions, unlike the other phalanges, which despite having quite a bit of movement are far less limited compared to the thumb. Now talking about the metacarpals, so the metacarpals are split into pretty much 3 distinct features. So we've got the base, which is the most proximal, we've got the shaft, which is the longest part, and then we have the head, or the distal part. The head of these metacarpals is what articulates with the phalanges. We can see that all these metacarpals kind of have a curved head, or the distal part, and this allows for the tendons of the muscles that connect to these fingers. It allows them to stay in that groove and increase stability. With the thumb, they've got 2 special bones that help it raise it up even more, and these are another 2 form of sesamoid bones, so they're wrapped in the muscle or synovial sheath. Moving on from this, we can move to the phalanges. So we can see that digits 2 to 4, so from the index finger to the small pinky finger, have 3 phalanges. So we've got the proximal, middle, and distal phalanx. Digits 1 though, the pollex, only has 2. It's only got a proximal and a distal joint. In terms of the joints between the phalanges and the metacarpals, for metacarpals 2 to 4, the joint is actually synovial condylar joints. Condylar actually means knuckles, funny enough. So these joints here, which is the joints between the metacarpals and the phalanges, or at least the proximal phalanges, is a condylar joint. However, for the thumb, that joint's actually a hinge joint. And the rest of the joints between each of the phalanges, or the interphalangeal joints, for both digits 1 to 5, they're all hinge joints. So hinge joint, hinge joint, hinge joint, and also another hinge joint here. And that wraps up the bones for the hands. Please let me know if I made any mistakes. Stay in tune for the next video, which will cover the muscles of the hand and explain how all the movements in the hand work. Until then, have a good day.